6 to 9 a.m. on Power 98.7.
6:44 here on the Power Breakfast. So, the World Health Organization says that COVID-19 no longer represents a global health emergency, a major step towards the end of the pandemic that has killed over 6.9 million people and disrupted the global economy and ravaged communities. The WHO's emergency committee met last Thursday and recommended that the UN agency declare an end to the public health emergency of international concern, which has been in place for over 3 years. The WHO's emergency committee first declared COVID-19 as a global health emergency on the 30th of January 2020, but the WHO has also warned that the end of the emergency does not mean that COVID-19 is over as a global health threat. Let's speak to Professor Salim Abdool Karim, who's, of course, infectious diseases epidemiologist and director of the Center for AIDS Program for Research in South Africa. Thank you so much for joining us again, Prof. Good to have you again.
Good morning, TT, and good morning to all of your listeners.
So what then are we supposed to, what is we supposed to understand by this now? Because I think as far as South Africans are concerned, COVID-19 disappeared in the middle of 2021 even. Behaving. But what really does it mean now with this technical and this announcement? What does it really mean?
Right. So the World Health Organization has, under its regulations, the ability to declare a public health emergency of international concern. It's for short, it's called a FEAC. Mm-hmm. Now, this public health emergency declaration enables the WHO to collect certain surveillance information. It enables the WHO to coordinate between countries. It enables the WHO to institute certain regulations and certain activities. Now, in this decision that was made on Friday, the WHO is saying that we are no longer in an emergency situation. In other words, we are now in a different stage of the pandemic. Now, we are still living in a pandemic. There are still cases occurring in almost every country. There are still hospitalizations and deaths that are occurring in every country. I mean, just in the U.S. on Friday, there were over 100 deaths from COVID-19. So it's not saying that COVID-19 is over. In fact, we all know it's not over. It's just saying that the hospitalizations and the deaths and so on are not now do not constitute an emergency anymore. We now have to deal with it like we deal with other infectious diseases, like influenza and other things. So that's what this is.
Okay. So what does then that mean in terms of individual countries? Because I know that the U.S. had the U.S. president had come out last year already to say that the pandemic was over. The EU spoke about this in April last year as well, saying the emergency phase of the pandemic was over. What has been our approach, and what actually should be the approach around the world?
So most countries have been letting their emergency regulations lapse. In the U.S., they have very specific things that happen when they declared their pandemic emergency. And in those things, for example, millions of people who are not covered by insurance are suddenly covered by insurance. They get free testing, free treatment, free vaccinations. All of that occurs only when there's this declaration of this emergency situation. For example, in Japan, which just lifted their emergency last week, it now means that people don't have to wear masks in enclosed spaces and so on. It eases all of those regulations. South Africa, we eased our state of disaster long ago. So we sort of came out of it a lot earlier than many other countries have. So it doesn't mean that much for South Africa because we've already eased our state of disaster. It just means that we just need to be continually vigilant. That's all.
Prof, as you say, that actually the COVID-19 hasn't gone anywhere. It's still out there, and it's still, most importantly, it's still killing people. How is it actually being picked up? If there is a general assumption and the conduct of people is as if it doesn't exist anymore, is it being picked up in hospitals? For example, if somebody comes in presenting what we would have thought of as COVID symptoms in the past, are they now just being assumed to be a flu as opposed to COVID, somebody being tested for COVID?
You're right in that we have reduced our testing markedly. So what has happened is that because we've got a lot of people who've been vaccinated and a lot of people who got natural infection, in South Africa it's estimated that probably in the region of around 80, maybe even up to about 85%, 90% of people have had natural infection, and about 50% or so, particularly of the adults, have been vaccinated. So that means a substantial number of people have got some kind of immunity, and and a high proportion have combined immunity, what we call hybrid immunity. They have both vaccination and a natural infection, which is a very strong kind of immunity. So when they pick up new infections, the infection is very mild. So mild that they don't bother testing and they don't bother doing anything about it. In fact, many of them don't even know they've got it because the symptoms are so mild. So that's where we are. So you're not seeing the hospitalizations, you're not seeing that. If you do get admitted, because it's still in infectious diseases, hospitals test. So you will get a COVID test if you go to hospital with COVID-like symptoms. But that's about where it stops right now.
Right. And it's just finally an ominous warning as well from Mr. Gabriesus, or Dr. Gabriesus, saying that there could still be the WHO could still declare a public health emergency in future. So it's not, he hasn't ruled out that possibility. What are we to make of that warning? I mean, is it just a logical, I mean, if you're saying that the virus is still out there, is that the only logical thing to say?
Yeah, so, he's referred to as Dr. Tedros very affectionately.
Okay.
Dr. Tedros said something which was really fundamental and important, and that is that the reason we've been so concerned about this virus is that because it causes waves of infection. And the waves of infection occur because there's a new variant of concern. Now, we haven't had a new variant of concern after Omicron. And so that means for the past 17 months or so, we haven't seen a new variant of concern. We've just seen variations on Omicron. But the threat that there'll be a new variant of concern that will be called pi when it comes, that is ever present. No one can predict that there's never going to be a pi, or pi is going to come at this time. It's not predictable. Like no one predicted Omicron, no one can predict what's going to happen and whether we'll have pi. So if pi occurs, it is very likely that the WHO will have to go back into a public health emergency of international concern, because it'll need to make vaccines, treatment, diagnostics, all of that available again. So for that reason, they always keep that option open, because it's an ever-present threat.
Professor Salim Abdool Karim, as always, good to engage you, and thank you so much, as always, for your insights. I appreciate it.
Absolute pleasure. Thank you, Titi.
Of course, he's an epidemiologist, a name that has become very familiar to all of us during the COVID-19 pandemic and during the hard lockdowns. He was an advisor to government. Still to come here on the Power Breakfast, we'll speak to the leader of Al Jamaa, Mr. Hanif Hendricks, is standing by for us.
The iconic Africa's Travel Indaba will take place at the Inkosi Albert Luthuli International Convention Center